This week, medical terminology topic is directional terms, body positions, and imaging terms. When we're talking about directional terms, position of the patient, body planes, things like that, we're going to assume that the patient is in the anatomic position, which is the image you see here on this screen, standing, facing forward, arms to the side, palms facing forward. This is helpful when you're trying to understand or explain or um, talk about these body positions that we'll get into. So, first thing, combining forms uh, related to directional terms. There's a list in the chapter 3 that gives more examples than this, but these are some of the highlights here. Antero, so anter is the word root, right? And then O/O is the combining form. So antero, we're talking about the front of the person. Dorso, the tail. Postero is the back. Proximo, near the point of attachment. So the point of attachment of your arm would be your shoulder, and your elbow would be proximal compared to your wrist, right? It's closer to the point of attachment. Supero is above. So your neck is superior or supero to your chest. A few combining forms for imaging terms. Uh, this is a pretty short list in the book. Here's a few of them. Radio, talking about radiology, x rays. Sono is sound, um, probably talking about ultrasound. And tomo is to cut or slice. So that comes into play with like tomography, computed tomography, or a CAT scan, CT scan. Tomo means to cut or slice. Prefixes and suffixes for this week's terms. Prefixes, bi means two, uni is one. So if you see the prefix before the word root bi, you're talking about two. Uni, you're talking about one. So like unilateral would be one side. Bifurcation is a split into two. Suffixes. If you see the suffix at the end of the word, ad, all, ic, ior, is pertaining to. And graph would be an instrument used to record. Graphy is the process of recording. And gram is the actual record. So, like, radiograph is the instrument to shoot an X-ray. Radiography is shooting the X-ray, and then the radiogram would be like the X-ray, actually the image itself. These are directional terms built from those word parts. Cephalic is toward the head. Caudal is toward the tail. Distal is away from the point of attachment, further away from the point of attachment. Proximal is closer to the point of attachment. Kind of talked about this already. So your elbow is proximal when compared to your wrist. So it's closer to the point of attachment, which would be your shoulder. And your wrist would be distal um, compared to your elbow. Medial, we're talking about toward the middle, pertaining to the middle. Lateral is toward the side. Superior is above. Inferior is below. Antero-posterior is pertaining to the front and the back. So typically it's like a directional from the front to the back. Dorsal is toward the tail, toward the back. Ventral is toward the belly. Abdominal pelvic regions. I have a nice image here on this screen. We'll start at the top. Hypochondriac. So hypo is below, underneath. Chondria is cartilage. Talking about the ribs here. So hypochondriac is below the ribs. You have your right and left hypochondriac areas. They're way up here, below the nipple, upper abdomen area. Epigastric is in the middle, in the top, above the umbilical area. The umbilical area here, you talk about your umbilicus or your belly button. This whole area around your belly button is the umbilical region. So above that is your epigastric region. And then you have your right and left lumbar. Those are to the right and left of the umbilical region. You have your right and left iliac. This term comes from your iliac crest, which is a bone in your pelvis. So the right and left iliac regions, and then the hypogastric, hypo below, gastro, stomach. So this is the low middle portion of your abdominal pelvic region. These terms are good to know. What's inside or underneath these regions is also good to know. But typically, what you'll see is the abdominal pelvic regions broken down into right and left upper quadrant and right and left lower quadrant. So just broken down into four. You see that more often when you're looking at charting or textbooks or anatomy, is just right and left upper and right and left lower. And that's just basically broken down into four even parts. Planes of the body. So the first one here is axial or the transverse plane. This green plane, horizontal line dividing the body into superior and inferior portions. So the superior would be everything above the belly button, inferior, everything below. This is your axial or your transverse plane. Your coronal plane is a vertical line that breaks the body down to anterior and posterior portions, divides the body into anterior and posterior portions. Basically goes across the middle of the head all the way down the middle of the body, and you have a front and back portion. Your mid-sagittal line is another vertical line that divides the body into right and left halves. So mid-sagittal is right in the midline, so directly in the middle of the body, going down from the top of the head, between the eyes, across the belly button, between the legs. That's mid-sagittal or midline. Parasagittal is similar to the mid-sagittal, but it's unequal parts, so it could be to the right or to the left. And sagittal, again, is going to be parallel to the mid-sagittal line, somewhere breaking the body down into the left and right. Some diagnostic imaging terms. Radiograph is the record of x-rays. So when we're talking about radiography, radiograms, this is x-rays we're talking about. X-rays are a picture of your bones, basically. Shows us dense structures within the body. Sonograph, we're referring to ultrasound. So sonography, sonograph, sonogram, that's all going to be referring to an ultrasound. The images you get when you bounce a bunch of sounds off the inside of your body, it's great for telling us internal structures, soft tissue structures. It's what you get when you're pregnant and they want to take a look at your baby. An ultrasound also can look at your blood flow, internal organs, things like that. Fluoroscopy is similar to an x-ray, but it shows like moving parts. It gives a live image. So they're basically shooting an x-ray, but looking at a live image on a screen. So if someone's getting like a heart cath, they'll put dye in their body and they'll use a fluoroscopy machine to look at x-rays and see how that dye travels through the body up to the heart. It's like similar to an x-ray, but it's a live image. Magnetic resonance imaging, or an MRI. This uses high-powered magnets to look at internal structures, bones, soft tissue, blood vessels, blood flow, all that kind of stuff. Computed tomography. So we talked about that tomography term already. That's like slicing. It uses a computer to take x-rays and a whole bunch of slices. So it gives us a 3D image basically of your body by taking a ton of x-rays at the same time, hundreds of x-rays, slicing them together, using a computer program to give us an image. Some abbreviations from this week you should know. CT stands for computed tomography scan, or also known as a CAT scan. If you see CT or you hear CT or CAT scan, they're all the same thing, computed tomography. MRI, magnetic resonance imaging. Most people just say MRI. NM is a nuclear medicine scan, or a nuke med scan. They use nuclear material inside the body, and then they take pictures of it and gives them images based on the amount of nuclear medicine absorbed by the tissues. They can be given IV, or sometimes they'll breathe in some nuclear medicine and they take pictures of their lungs. US stands for ultrasound or sonography study. Ant would mean anterior. It's short for abbreviation for anterior, the front of the body. Inferior is lower. AP, anterior posterior. So we talked about front to back. Again, it's on there twice. Inferior, and then lat is lateral to the side. There are definitely more abbreviations. Those are just some of the highlights.